Hello, ladies and gentlemen. Welcome back to another episode of our podcast, where we delve into the forefront of innovation shaping our future digital. Today, we embark on a journey into an ever-evolving landscape of healthcare, exploring the boundless possibilities of digital health and its transformative impact on our life. In today's episode, we will unravel the mystery of future of digital health. Before that, let's first understand what is digital health or digital healthcare. Digital health is a broad, multidisciplinary concept that includes concepts from an intersection between technology and healthcare. It includes navigating through the convergence of technology, medicine, and patient care, from AI-powered diagnostic to remote patient monitoring, telemedicine to wearable devices. The possibilities seem limitless, and the potential for improving healthcare outcomes is unprecedented. Throughout our conversation, we will explore the key questions such as shaping the future of digital health, how will emerging technologies redefine the patient experience, what role will the data analytics play in personalized medicine, and how we will ensure the equitable access to healthcare innovation for all. And to learn more about it, I am thrilled to have with us a visionary leader who is at the forefront of revolutionizing healthcare through technology. Please join me in extending a warm welcome to Mr. Mukesh Sinha, the co-founder of Gravitas AI. Mr. Sinha is an accomplished leader and entrepreneur with nearly 3 decades of experience in healthcare and health tech ecosystem. He is currently the co-founder and COO of Gravitas AI Limited UK, a startup focusing on digital health. He is certified independent director and ESG expert too. Mr. Sinha has a proven track record in the healthcare industry, both MNCs and Indian companies. He has been honored many prestigious healthcare and entrepreneurship awards. He holds advisory board position and is recognized as a guest speaker at national and international level. So without further ado, let's dive into the future of digital health with Mr. Mukesh Sinha. Thank you, sir. Thank you very much for joining us and giving us your valuable time. Thank you very much. And here's my first question. What is ahead for the patient for the future?
So the potential of digital health, just right now I mentioned, world exposed to that post-pandemic or during the pandemic, right? And it is not just only limited about to with the consultation process. It is right from the OPD procedure, taking the consultancy, even drug development, product development are now based on the technology, particularly the data-driven. And one of the very great example I'll give you, like vaccine. When the vaccine has been developed during this pandemic period, usually on an average, the development of any vaccine is take few years, at least 3 to 5 years kind of thing there. But we able to develop just couple of months. In fact, India is also developed their own there within an 8-9 month period. It is only happened based on the sample, a very small sample size of the patient, and they have calculated the data, like how it is going to be. If it is like 1,000 patient, this is the data, what could be the, with the few thousand or lakhs kind of thing there. And based on that, okay, this is the positive side of the medicine, and these are some negative sides. So based on the merit of the product, they are able to develop the medicine, or even the many of the equipment is come in built with the AI technology. Even diagnostic is also now much more dependent on the AI, ML, IoT, all these things are there. So accuracy is again dependent upon the data. So data is also now coming through this the technology integration. And day to day, even to large extent, even administration part, like, okay, connecting with the front desk staff, asking about question and answer related to hospitals. In popular terms, we call the chatbot. So it is now, this is now you have a 24/7 access through this technology. So many things are possible. And as for future is concerned, the core healthcare is across the world, whether it is a poor country, developing country, or developed country. Healthcare cost is one of the biggest issue. So all the elections, like India is passing through the election, similarly after a few months there would be US election and UK election. Healthcare is on the center stage. And the cost of the healthcare can be reduced through the intervention of technology. So it would be more affordable. It is more easier to access across the world.
Correct. Understood. So my second question will be, many hospital market themselves to be the paperless and contactless. But even today, there is still a large room for improvement and optimization. While the transition takes time and is understandable, so it need not mean that the future of healthcare should solely to be about shiny, bigger or more modern hospital. What's your point on this? Like how you see that many of the things are like this?
So in healthcare technology, like it's evolving stage, advanced hospital, big hospitals who can afford, they are already started this digital journey. So when we talk about paperless, means everything is now in technical terms we call the EMR system. So it is getting a patient prescription from one table to another table, or one room to another table. It is a digital uh, prescription is being transferred there. So you are mapping the journey of the patient at each stage, whether it is a consultancy, whether it is diagnostic, whether it is the surgical procedure. And at the end, patient can have the digital prescription or like a printout. So that making the data safety security are like more secure now. Chances of getting prescription lost, when you lost, you have something data in your mobile itself. So it is an important thing. So that way, if the patient is coming, usually like the country like India, patients are coming from the remote area, and suppose they forget to carry the prescriptions, but you have all these records saved in your system itself. So by this patient ID or mobile number, you can track the entire history. And Government of India pushing this digital health into large extent. So everybody's health data would be stored somewhere in the system itself.
Oh, that's good to know, sir. Like the government is also pushing the digital health segment and all these things. And in the now jumping on our next question, in the realm of digital health, what emerging technologies or trend do you believe have the potential to make bigger impact or improving healthcare outcomes? And how can we ensure equitable access to these innovations?
Yeah, many of the new technology, like particularly AI, because AI is now anywhere and everywhere. So that is disrupting the entire healthcare, and how it is helping the outcome, because now data accuracy, surgeon can find correlate with their skill, that what are the data are coming, and so he or she would be in much better position to give the proper treatment. Now, with this, even customized treatment is very much possible. These days, you have seen the overall awareness on healthcare is increased, so people are wearing this lot of devices, including your mobile is coming with a lot of data. You can measure your heart rate, you can measure with the BP, and even now sugar also. There are something chips are there. If you put on your body, you can able to measure the sugar data anytime, and live data kind of there. So all these wearable devices, new equipment, drug discoveries, are all these are the part of the technology disruption, and hopefully all these things are happening quite positive. And top of that, these days you might be hearing about the robotic surgeries.
Exactly.
So yeah, so this robot is filled with the data. So the data and everything is accurate. So robot can help the surgeon to how to go to the point by point where they want to perform the surgery. So there would be less scar, there would be less any kind of cut and other things are there, and chances of expected outcome is much you can say as per the plan it is the outcome would be possible.
Oh, yes. Thank you very much. Like it's very insightful, Gopal. So, like the next question is, as the digital health technologies continue to evolve rapidly, what are some key challenges or barriers that healthcare system and providers face in the adopting and integrating these innovations into their practices? What are the roadblocks in digital healthcare in India as compared to abroad? What do you see?
I would say the biggest challenge is about the regulation, because the technology is coming. So accordingly, a lot of companies are coming. So it's mushrooming. I would say everybody is now saying we are the digital service provider. but it is important that it has to be regulated. So it has to be used as per the plan. There should not be misuse, because health data is, again, it is very, very private and very important data. So it should not be leaked or should not be used for the other purpose. So regulation is very much important, so that there should be no play with the life or with the individual. And second, uh, mapping the process, whether it is equipment are coming. So let's, before it is coming, it should not be get tested directly on the human life. It has to go through the processes like we do in the medicine development or other things. So it has to be first prototype, then it has to be tested on the lab. When you are 100% sure that okay, it is coming, then definitely the next process is to be tested on the animals, and last stage it has to be on the human being. So you are, because everything has a two side, positive and negative, though chances are very high that it is positive, but we should also try to reduce as much as possible. And based on the merit of the new technology, you should start using on the day to day in your practice. So uh, regulation is important. And second, about data, safety and security are equally very, very important.
Correct, correct. So I was jumping on the same point, sir. The data privacy and security are significant concern in the realm of digital health. So, nice. How can we strike a balance between the leveraging data, patient data, to drive advancement in the technology, healthcare technology, while also safeguarding individual privacy rights?
So it's a start right away from the education. So if you are going to test something new product or something there, so patients should aware about that.
Correct.
So education at the end consumer, in this case, consumer means patient, they should aware about if something is being used in my treatment. So he or she should be aware. And second stage, patients should know that this process has already been tested and approved by the regulator, so that the efficacy are much assured compared to like just testing and trial kind of thing there. And third, about the most important thing, uh, how you can use this data for universal information. Because just example, right now you are using some test is getting done from the one lab. When you go to the another hospital, they said no, it is you have to again. So if it is like standard protocols are there, so test is if it is get tested in one particular pathology lab, it has to be accepted across the country or even global level. That I would say that should be our aim. So that way you are reducing the effort, you are reducing the cost, and see huge convenience for the patient. Patients knowing everything, they have all the information also there in the mobile, laptop, and if required, the printout, he or she should be provided that. Another very, very important in the healthcare services, particularly when you are going through the surgical, insurance claim and reimbursement are very, very important. Right. So if all the process, because this will bring the transparency in the healthcare. So if everything is there, so very first stage, because you need to just share the data. So you should provide the access to all authorized. Authorized means whosoever registered with the government agency or the regulator, they should have access the data. So the moment they can see the data, and based on that, there should be no dispute. So it's a huge relief for the patient also. Okay, whatever the surgery cost would be there, it is taken care by the insurance company, or he or she need to pay from the pocket. So it will bring a lot of transparency also.
Correct. So मेरे को ये जानना था, how much India is ready on this? Like people जो data privacy होता है, so most of the patients का ऐसा भी रहता है कि कभी उनसे पूछा जाता है कि उनका कलेक्शन लेगा और ये सब डेटा स्टोर होगा, कि उनको ऐसा कुछ बताया भी जाता है इस तरीके से?
See, ये स्टैंडर्ड प्रोसेस है हेल्थ केयर में. जब सर्जरी होता है तो डॉक्टर्स यूज टू गेट द कंसेंट फ्रॉम द पेशेंट और पेशेंट रिलेटिव.
Correct.
Right? But it is not been informed in very informal way. वो बोलते हैं यहाँ पे साइन कर दो. So patient, because they are already on the panic condition, her brother, sister, parents is inside, going inside the OT. So without reading the things, they just sign it there.
Right.
And this is the case across the healthcare, whether it is small clinic or big hospital. If you go outside the India, because my daughter is like in UK, she is doing the studies. So they will inform there would be proper session on that. These are the things there. These are the risks, these are the benefit, and details are mentioned on this document. Please go through that, and then they give the next day. Okay, then next day you get the confirmation. Here they say outside the OT server, you just sign it. So you have no other option because you have to sign it. So I think it is not fair on the patient to give the half information. So it has to be full information need to be provided, and there should be proper consultancy process. And in this case, I think again technology would provide a lot of information and transparency. Like just an example, I was talking about the chatbot. Suppose all this information been already downloaded on the system, and chatbot is a multilingual because in India kind of country you have Hindi speaking people, English, Urdu, Punjabi, a lot of different there. So that will help to understand, okay, what is mentioned. They can go and search all this information. And it is since it is in the mobile 24/7, so they can share with their relatives and other things are there. So definitely technology will help to get this information sharing more and more transparent way. And it will help to bridge that trust deficit because people are now talking about healthcare is a business and there is a huge gap. So always you have seen that there is a dispute after the surgery as far as there before the surgery some X amount has been told and post surgery there is something different or on that table many times surgeon need to take the decision. So cost get it's a two-way process. So I think all this information has to be provided on more proper way and the way the patient understands. So that is also important because many times a doctor used to talk in English and the person who's sitting across the tables, they may not be and तो बहुत सारा चीज है. So there is huge scope and technology can help them to bring this transparency.
अच्छा सर मेरे को ये जानना था like coming on the digital health only, so where India stands in the healthcare digital health as compared to the western world और अभी तो UAE segment में भी बहुत टेक्नोलॉजी बूम हो रहा है वहाँ segment एक बहुत टॉप पे चलता है. So where do we stand right now as compared to when we compare to India and in the western world?
In general, we have seen that technology adoption in India is much faster and it is impacting across the sector. Whether it is payment system, you have seen that almost 50% of digital transaction in the world is generating in the India.
Correct.
So, and why it is possible? क्योंकि उसमें वो system है काफी simple है. Anybody, whether you are educated, uneducated, whether you understand particular language or not, they know that this is the process. आप scan करो, आपके account से उसके उधर account में जा रहा है.
Correct.
So that way, I would say digital literacy or acceptance is much higher. Healthcare, it is started, and I'm sure India is going to take the lead. Particularly the government itself, they are pushing this agenda quite just like you have Aadhaar card, so you are going to have the health card also. So Aadhaar is like Aadhaar number kind of things would be there. So your healthcare data would be already downloaded and would be saved in some sort of card. And wherever you're going, suppose you are going with some critical case like injury and other things, so hospital would able to just by going to log into your the number, they will able to know, okay, you are diabetic, so that they know that, okay, so diabetic, what kind of medicine need to be done, another thing. So it's a question about few years, but India is definitely going to lead this digital health in the world.
Good to know that. Good to know. Sir, अभी एक कियोस्क बहुत चलता है. कियोस्क हो गया, telemedicine हो गया. So, what are the opportunities and challenges lies ahead in its continued integration into the healthcare delivery segment? और इसको मतलब ये टेलीमेडिसिन सेगमेंट है. अभी एक मैंने देखा था एक डिवाइस आया है कि where you put your symptoms in the machine and it will diagnose you and give you the prescription and all those things. So how much reliable all those things और इसका कितना impact है, इंडिया कितना रेडियस है? in the rural segment especially.
Data and information point of view, it is okay, but healthcare, any finding and other thing has to be evaluated by the doctors. They
Correct.
are going through 5 to 7 years or 10 years kind of rigorous education, right? Just example, to measure your test or for the blood papers, you are measuring with this your instrument, but it has to be again validated, because depending upon what are the symptoms, doctors would be able to give you the accurate things there.
Correct.
So for preventive healthcare, okay, getting test and you can say, okay, this is okay, it is coming very consistent, so might be it is okay. But in case of it is coming the fluctuation, so it has to be evaluated and confirmed by the doctors. To some extent, it is helping as per the preventive is concerned, but in the case of critical case, you should not start using, because there's a lot of medicine details are available in the Google also,
Correct.
right? So it may be suitable, it may not be suitable, and data what is there in the Googles is not medically approved.
Right.
So that is suppose you have already allergic with some particular medicine, if you have not gone through that, and just based on that you're finding, okay, this is this particular salt and medicine is also for the allergy, if you're taking it and if your body react to that particular medicine, so it can be life threatening also.
Correct.
So just data, and for awareness point of view, okay, since I am a diabetic patient, so I keep on checking my blood sugar. But moment it is get more fluctuation, it is always getting recommendation from the doctors, and based on the data, he and she would be much better position to recommend the medicine.
So sir, मेरे को एक व्हाट्स योर टेक, अभी एक एप्स आते हैं, बहुत सारे एप्स हैं, एप्स के नाम नहीं लूंगा, वहां पर कंसल्टेशन इजीली हो जाता है, यू टेल योर सिम्टम्स, और वहां से कोई भी एक्स डॉक्टर रहेंगे, वो आपको प्रिस्क्रिप्शन दे देंगे। हाउ मच यू, मतलब आप कितना उसको रिकमेंड कर सकते हैं, क्योंकि अभी ये बहुत बूम है, आपको भी पता है वो सारे एप्स कौन से हैं।
For regular kind of checkup, I would say कि आपको fever है, ये चीज है, then because again in India, if you go outside the India, any antibiotic you will not get it from the chemist shop. यहाँ पे आप chemist shop पे जाओ, आप बताओ कि मेरे को infection लग रहा है या I have irritation something, the chemist itself recommends some medicine. So it is not the healthcare kind of thing, just convenience point of view. Doctor had already provided the medicine. Instead of going to the chemist shop, okay, you go online and you can say this is the medicine and you are getting the medicine. Regular checkup hai, or you instead of going physically waiting for like a few hours, again that is the time consuming. So okay, instead of that you can go online, because an online doctor is also there, and as long as there is no intervention is required, no body touch is required, doctor of course based on your symptoms they can recommend okay, these are the medicine. So for regular checkup, I would say, because that is helping a lot to the patient. It is convenient because from the sitting from the particularly for elderly patient going every time stepping out from the house and coming back, that itself a lot of hassles for them, but that get the convenience. But any case, any times any serious issue, it has to be physical one-to-one. That is more recommended. So utilizing the this technology, online platforms with some judgment based on your wise decision, you can continue to do that. But any critical case, don't take the risk. Okay, some critical case, and you're going to take the online advice, because it has to be cross-checked with many other diagnostics. So that is the problem. Just example, when you say कि हमको पेन है, so ये पेन इन्फेक्शन के कारण भी हो सकता है, ये पेन इंजरी के कारण भी हो सकता है, ये पेन कोई दूसरे symptoms like if you are too much exposed to the sunlight, उसके कारण भी हो सकता है. So doctor are the best thing to say that okay, this pain is coming because of these are the indications, so they can recommend, because all these three just painkiller is not enough, because sometimes apart from painkiller is required some sort of like antibiotic and some other medication is also required.
Exactly.
So,
Okay.
So that is important part. So I would say mix of both the things would be much easier. better. And another very important thing, it has to be holistic healthcare. Holistic healthcare means a combination of natural therapy, combination of Ayurveda or other Unani and other kind of thing there, and allopathic. Because many times just going to allopathic, because there is no any medicine which doesn't have any side effect. So every medicine, if you're using for the quite long, there is a side effect. But particularly in Ayurveda and naturopathy, the side effect either is not or it is very less. So depend upon case to case, the holistic healthcare is always better. And fortunately, post-COVID, everybody is aware that we have been talking about health is wealth. So literally, they know that health is wealth. So preventive healthcare is the best things there. It has to be your way of life, doing yoga, exercise. It is very important to day-to-day life.
Preventive healthcare is the next boom in the across the healthcare segment. Sir, ये digital health की हम बात करते हैं. So, what's the last final question from you? Like we understand the telemedicine, the apps that are working. Because ये government, how much government? What are the schemes from the government's segment? Digital health को push करने के लिए across India. ये is there any scheme or something? कितना government serious है इसमें?
The scheme has, just like telemedicine, many of the government hospital is also using the telemedicine, but it is not very established practice. Second thing, you know about गांव में जो है वो semi educated nurses, उसको क्या, I think they use some term, trying ASA worker. I was talking about the ASA worker.
Okay, ASA worker.
So some of the like remote area, getting the hospital infrastructure itself is a huge cost. And it is not only in India, across the world, even like the country like US and other developed countries, getting healthcare at remote area is not so easy, or if it is there, it's very costly. So government of India is trying their best to utilize the one is digital health, so that if it is some sort of expert is required, they are connecting with the tertiary center there. Training to the semi-educated person and continue training, that will also help there. And in the process of their coming with the Aadhaar card, so just like they're mapping the individual healthcare card. So that going to be the next big thing. So irrespective of the location, like you have ration card, if you are in particular, आपके घर का गांव का बना हुआ है, but they can use it in some other area. So now an Ayushman card. So all these things are basically trying to map up the individual health. And anyhow, in government hospital, it is a free of cost. So infrastructure is getting developed, but it is long way to go. Digital health will help to have that access across the country. So that is the important thing. So it's like all the things has to be interlinked, so that then you can have the good access to the healthcare.
Got it. And last final question, sir. What do you see the future of digital health? How you take it? What's your note on this?
Digital health is definitely, because health is your fundamental right. So it is going to, and irrespective of the status, whether it's your poor, you are a mid-income group, or you are a high net individual, still healthcare bother to all. So and one of the biggest challenges I told you, not in India, across the world, affordable healthcare is the very challenging things there. So digital health is helping to reduce initial cost are there, but over a period of time, it is getting reduced because you are using less and less skilled human power, more and more technology. So that will make the access to the good healthcare, and it is under the UNO also, WHO is a fundamental right to that by 2030, I believe they say everybody have a quality healthcare. So we are very far away, but to bridge the gap, The digital health is the next important. And but acceptance, our good part is that acceptance are quite high across the world. Step by step, people are accepting this digital health. So digital health is the way to go, in fact, in the healthcare.
Thank you very much, sir. Thank you very much. So as we conclude today's episode on the future of digital health, so I want to extend my sincere thanks to to you. The journey into the digital front frontier of the healthcare has been eye-opening, and let's continue to embrace innovation, collaboration, and compassion as we shape the future where healthcare is more accessible, personalized, and effective for all. Thank you very much, everyone, for joining us, and for this. If you like our content, if you like what sir said, if you like our we are working very hard to get these people, or just to learn, just to educate you people, and what's what's trending in the market, as well as we have to update ourselves time to time. So if you really like our content, please like and share, subscribe to you, and please join us for the future podcast. Thank you very much, sir. See you next time. Until, thank you very much.
Thank you, Farooq. Thank you, and thank you all. Bye bye.
Bye bye.